Foot surgery has become increasingly important over the past 20 years. The volume of operations has increased, and this is also due to improved intervention techniques and reliable procedures. When orthotics, specially fitted shoes and physical therapy can no longer relieve pain and discomfort, it is time for adaptive surgery to enable people to walk and exercise normally again. The various loads placed on the foot while standing or moving affect how the bones, joints, ligaments and muscles interact. The foot has more than 2 strong bones that are connected to each other by both fixed and movable joints. All these structures are located quite superficially and are therefore easily accessible during surgery. Daily stress on the feet, especially in the case of congenital or acquired malalignment and genetic predisposition, leads to wear and tear on the anatomical structure of the foot. Foot and ankle injuries are the third most common type of injury overall, after wrist injury. Sports injuries affect the foot and ankle areas in almost 50% of cases. In this case, the severity of the consequences of injury can range from bone fractures to damage to soft tissues, joints and ligaments. The peripheral position of the foot allows the operation to be performed in conditions of blocking the access of blood to it. This way, the surgeon can see the surgical area very clearly and your patient will experience minimal trauma. In addition, local and conductive anesthesia techniques are used, which allow the operation to be performed without general anesthesia and a smooth transition to postoperative pain therapy. German specialists develop anatomically adapted implants and instruments that make surgery happy and reliable. This means that the patient has long-term postoperative stability and early subsequent functional treatment. Therefore, foot surgery can often be performed on an outpatient basis and, especially with forefoot surgery, long hospital stays can be avoided. Making a diagnosis begins with a conversation with a doctor and an examination. X-ray methods and other diagnostic tests allow us to create an individual treatment plan for each patient. In modern orthopedics, various types of diagnostics are used, including X-rays, magnetic resonance imaging, computed tomography, diagnostic arthroscopy, and there are applied computer methods for studying gait and foot function. Hallux valgus is the most common situation requiring foot surgery. Multidimensional movement of the bones of the foot, big toe and first metatarsal bone, with deviation of the big toe and the presence of a protruding bone, leads to pain when walking and difficulties in choosing shoes. The special appearance of a middle-aged woman above the bone of the disease, as a rule, painful bursitis, inflammation of the joint tissue, occurs, which can lead to a significant deterioration in foot function. Initially, treatment consists of under-eye wear and insoles, as well as anti-inflammatory and decongestant measures, from physical therapy to medication. In case of severe deformation, only surgical treatment methods are possible. More than 400 types of surgical correction of hallux valgus are known. Today, corrective multidimensional osteotomies, cutting bones in different directions, are usually used in conjunction with soft tissue techniques. Depending on the degree of deviation of the toe, additional intervention at the base or cosmetic intervention at the head of the first metatarsal is necessary, which provides good results. Stable fixation techniques during operations make it possible to quickly make the patient ambulatory, and rehabilitation takes place in the final functional shoes.